Thank you too much. My name is Ulf Hertin. I'm from RxEye, and my dialect is from Scandinavia, from Stockholm. Thank you for introducing me. I would like to start with a philosopher, the philosopher of Antonovsky. Maybe some of you know him a lot, but he said there is two things, there is a major achievement if you have success. The first thing is if you can navigate in your systems you are present in. And how did he research that? You know, from the Nazi camps, he found out that the women from the Nazi camps, they could figure out that have some happiness. And how could they receive some happiness? They receive the happiness because they can see themselves from the outside. They put themselves on the shoulder and they can see themselves from outside. If you can understand why the actors in the camp act like that, I think they can navigate and they felt happiness more than other people. So one of the key success factors, if you can navigate into the systems you're working with. I think one of the key success factors for biomanx cluster, if you can have regulations and interpretation of how you should navigate. The next success factor is a cliffhanger. So what we have here, and we have already been discussed a lot, that we have an aging population and we see it will rise. The life expectancy increases 3 months yearly in Europe. So it's right that Jim Mellon said in the morning here that these people who is born today will be more than 100 years. This is the facts we need to take in consideration how we should act accordingly. If we go on to the medical imaging, where I come from, we can see that all the complex studies that we are doing today are rising. It's more numbers of them, and it's more complex of the study. We have MRIs, we have CT, we have PET-CT, and all of these are molecular studies that we are trying to achieve. MRI exams are rising, and the CT exams rising tremendously. The numbers of doctors who should interpret this are not rising at all. So you need to put another systems in place how you can solve the situation. The education in place is not there. The same thing here is that we have the subspecialism. The healthcare is not only one discipline as it used to be, it's several disciplines. And the disciplines is more and more sub-expertise, and these sub-expertise hasn't the ability to reach the expertise in one hospital like Oxford or in Cambridge or wherever they are. You need to collaborate in between these university and teaching hospitals to reach the right expertise to give the patient safety care. One of the shortages of the specialists here is pathologists. And now if you come to independent pharmacy or specialist pharmacy or individual pharmacy, you need to have pathologists who can do these sequences. The sequences is more cheaper, but the expertise who can do this and can interpret all these sequences of biomolecular things is not there. And you can see here, in Sweden we have 2 pathologists of 100,000 people, and we have more or less the same in UK. And if we should be able to treat cancer patients and the inflammatory diseases we can see in front of us here, we need to act differently to make that happen. We need to have more collaborations, and we need to see how we can do that. You have all of you have read about the medical errors that we have in healthcare, and it's now present, and it's now a fact that we have too many of the complexity studies that we are not able to interpret rightly. So 25 to 35% of diagnoses are wrongly or not really interpreted in the right way. How can we read the expertise to support local hospitals to read this kind of diagnosis? And the main problem is that we have too much of the advanced method and not enough with the expertise who can do these interpretations. So solution for that is that I think we need to have a network collaboration across the globe. Not only think that we in our teaching hospital have the right expertise at the right time present for patient care. We need to have this collaboration networking and utilizing each other in a more efficient way. And if we can do that, I think we can save life and money a lot. If we can also start to discuss how we should do this interpretation, I think that can increase and improve the healthcare a lot. A man from Sweden, from Boston Consulting Group, he said that recently that if we can do this kind of orthopedic exchange of the right data, we can save a lot of money, and US doesn't need to have a crisis in the healthcare industry. And the same is in this area. We need to see how we can collaborate and how we can get access to this expertise. We have started to establish this diagnostic network. For example, in Stockholm we have colorectal cancer. You know, these patients are often coming too late to the doctors. They have been treated in the GP systems too long, and when they appear into the hospital, they have not so many months or years to live. And how can we improve that? And how can we do that? Is that if we can find the expertise and they can work in a more network society, independently of borders, we can increase and improve the treatments of even these seldom cases. Yeah. So the structure here is that we have silos of radiology and pathology and surgery and oncology, and we have a patient-centered care as a pathway across that. If you take away these kind of radiology, pathology, surgery and oncology and put hospital names instead of here, we have the same silos and the patients going across here. If one patient will have a rare cases, a rare disease here on the island, he need to move to Liverpool or London or whatever they are, because he need to have the right expertise. If you can send the studies into London, into Manchester or Liverpool, and they can be enterprise and support, you can relieve and you can have better outcome here on the island, and it's more convenience for the patients to stay on the island to get these diagnostic services. So what we have here is that we have more and more multidisciplinary team collaborations, and the cancer treatments protocol says you need to act more in multidisciplinary team. These tumor boards, how should you act according to that? And this multidisciplinary team is a burden today for these clinicians who need to be present on this multidisciplinary team. And how can that be done? And how can you utilizing the expertise from different hospitals in a more efficient way? That's where we come in here. We have built a platform for collaborations in between hospitals, and the next thing here is that why we can do that is that we have a contract engine, and the contract engine set up relationships in between these hospitals, and these hospitals can act as they have been done in one organization. And that is the thing we do. So my proposal to BioManx cluster here, we can be one infrastructure for you. You can build up research program, and the research program could be global, and you can utilizing these kind of content and information sharing agreement to exchange information and data. Thank you very much.